Eosinophils are part of our innate immune defenses, but their increased activity is a risk factor in asthma. So, any genes which would promote the differentiation of eosinophils in the bone marrow, such as the interleukins, could increase asthma risk. Environmental factors which would increase eosinophil number would increase asthma risk. These cells migrate to the lungs and they promote more inflammation there. And the number of eosinophils is correlated with the severity of asthma, and one of the first signs of asthma is increased eosinophil migration there.